Great. Well, good afternoon, Dr. Xer. Thank you for joining us. For all of you for Take Flight TV, this is Dr. Xer from Mayo Clinic Health Systems, and he is a cardiologist. Dr. Xer, thank you for joining us today. Maybe we could start off by just having you tell us a little bit more about your role at Mayo.
Sure. So I joined Mayo not that long ago, about 6 months ago. Previously, I was working at Richmond, Virginia. Right now, I am the catheterization lab director, and I'm also starting a vascular disease program. That's any kind of disease that affects vascular beds outside of the heart.
Very interesting. Thanks again for joining us. Of course, we are always very interested in the heart health of our student athletes. Dr. Xer, if you could start off, one of the questions I have is, how can students start incorporating heart healthy habits into their daily lives?
So heart healthy habits pertaining only to exercise, it's usually the earliest you start in life, it's the easier. Sometimes some people wait and they want to start when they are in their 50s and 60s. And sometimes they unfortunately start after they have a heart attack or they have some health scare. But the younger you are, turns out that most of the times the people are healthier when they are younger, and it doesn't take that much effort to actually start an exercise program that will be considered heart healthy. So walking, and especially if you could do it in increments of 30 minutes every day, 30 minutes to 1 hour, it's a very healthy way to start incorporating some healthy habits. Perhaps if you just do like very short-term goals, like tomorrow I'm going to run for 1 minute at 5 miles per hour. So something that you know you can more or less do, and then you can go up to 2 minutes and 3 minutes, so forth and so on, until you get to the time that you would like to have completed, maybe 20 minutes or 30 minutes a day. So small increments actually help a lot, and that helps actually train your heart, which is what you would like to do as far as healthy habits.
Dr. Xer, how does aerobic or cardio exercise improve our heart health, or in the cases of our student athletes, our athletic performance?
So aerobic is a very interesting way of training your heart. So normally, somebody that exercises for less than an hour, you will not have a whole lot of changes in your heart structure or your heart rate or things of that sort. So you can have a very healthy heart, even if you don't exercise for more than an hour. But if you're actually passing that threshold of an hour and you do it for years and years, then the heart starts becoming more athletic, really. So it becomes really efficient. With every heartbeat, it gets a lot of volume of blood outside. And with that, actually, it starts kind of saving some of the electrical power. So instead of beating at, let's say, 60 to 70 beats per minute, which is what we will normally have at rest, it is going to start going a little bit slower because it becomes really efficient. And the reason for that is if you are not conditioned, what happens is from your heart rate of 60, if I stand up and start running, it's going to just go up to 120 and you feel exhausted. Mm-hmm. But a trained heart, it will start at 40 beats per minute and it will ramp up slowly. Mm-hmm. So they can keep going and going and going and going. And that's why you see these athletes really like train for hours upon hours and they don't feel really tired because the heart has been adapting for that kind of effort.
Very interesting. Thank you. What role does stress play in cardiovascular health? We have students right now who I would think are stressed. It's final exams, they're getting ready for the holidays, COVID. How does that affect them?
Actually, stress affects you in every single way possible. And one of the things that it does, it actually increases the adrenaline that is in your body. And that, as a result, will give you small increases in heart rate and small increases in blood pressure. But even those small increases over time can actually pass a price to your heart. And actually, it will hurt your heart. It will actually increase your risk of having heart complications, not right off the bat, not right away, but you will have a little bit of more risk factors. It's very difficult to actually be a relaxed student. I've been there, done that, and I know we all know that it's very difficult, but you need to find some ways to do it. One way to do it is actually exercising, but there are some other things that help your mind. One of them is meditation, exercise that is not necessarily aerobic, but yoga, things like that can actually help tremendously to decrease your stress levels. And one needs to actually learn how to manage things that we can control and some others that we cannot control. That's, I think, one of the wisest things that one can actually pay attention to.
Great advice. Thank you so much for joining us, Dr. Exer. We really appreciate your time and your insight into this important topic. So thank you so much. Have a happy holiday.
You too. I enjoyed it. Thank you.
Thank you.